morning, everyone. This is definitely the best seat in the house. The view's amazing from up here. Okay, thank you very, very much for having me. First of all, I wanted to say a special thank you to the Rural Doctors Network, because without them I definitely wouldn't be here and my service would not exist. I think it was Liz who recognised that thinking outside the box and putting a nurse into a situation that's normally a gynaecologist's domain it had a lot of vision, and it certainly worked in this situation. So thank you, Liz. I don't think Liz is here today, is she? No. Okay. So first of all, an overview of I want to give you an overview of how this service developed. I want to talk to you a little bit about colposcopy, although that's a very sensitive kind of examination for women, as you might imagine. And I wanted to talk to you about where we're going from here. So to start off with, colposcopy is the examination of the female cervix under magnification and illumination using a colposcope. So a speculum examination, and for any woman, this can be extremely confronting and worrying to be sent for that kind of test. And you're normally referred for a colposcopy after you have an abnormal pap smear. So there's all connotations of cancer and all sorts of scary things for women when you're sent for a colposcopy to start with. Okay. So a little bit about myself. I'm based in Condobolin in the centre of New South Wales, and you can see that if you overlap those two maps, that Condobolin is, as is Orange, is in Wiradjuri country. I was born in Condobolin. My office now is in the now defunct maternity unit where I was born. So I'm definitely back where I belong. So from Condobolin I outreach to a number of the small communities and provide a women's health service, providing a range of gynaecological services, pill prescriptions, all sorts of things. Back in 2004, before I did my masters, we had no GPs in Condobolin, and our women were travelling to Orange, 2.5 hours away, to access scripts for the pill, and another 2.5 hours to drive home. So I did a masters to improve the services for women out there, and that's working very well. I now outreach to Orange Aboriginal Medical Service every month, providing a 2-day clinic for colposcopy. My education, as I told you, I was born and bred in rural, remote New South Wales. I actually did my training at the Children's Hospital in Camperdown, so there's a bit of a link between me and the last speaker, which is nice. And I'm also a midwife, and I've done various postgraduate education in sexual and reproductive health, immunisation, and my masters. Just a little bit on the cervical screening and the changes that have happened in the last little while, and I won't go into huge depth about this, but this is really how our women come to see us at Orange Aboriginal Medical Service. So cervical screening has halved the cancer stats in Australia since the National Cervical Screening Program commenced in 1991, which is great. The human papillomavirus vaccine commenced in the school-based program in 2007 for 12-year-old girls, and in 2013 for male students. The idea is to prevent cancer of the cervix through vaccination against HPV, and we now know that the PAP test now has been replaced totally by the human papilloma DNA test, which started on the 1st of December last year. The time between tests now has changed from 2 years to 5 years, and the age at which screening starts has changed from 18 to 25 years. So there's been big changes in that space. Of course, women with any symptoms of any age, such as unusual bleeding, discharge, pain, should see their health provider. And we do get a lot of presentations in the colposcopy clinic for that very reason. So, getting back to us and why we started. Okay, so this is a quote that I often use, and it says, "Of concern is that the incidence of cervical cancer in Aboriginal and Torres Strait Islander women was more than twice that of non-Indigenous women, and mortality of Indigenous women was 5 times the non-Indigenous rate." So that's a quote from the Australian Institute of Health and Welfare, and it's a clear indication that while progress is being made in many areas, there are still significant gaps in provision of healthcare within our Aboriginal communities. As I said before, in Australia, colposcopy has long been the domain of the gynaecologist, and communities with significant Indigenous populations continue to endure barriers such as distance, lower socio-economic pressures, the emotional stress related to being absent from family and country, lack of transport and the high cost of specialist care, all of which impact on the ability of women to receive care and may contribute to delayed diagnosis and treatment. This is a vital issue and needed to be addressed in order to improve women-centred, culturally appropriate services. In 2011, a large gap in service was recognised. Within Western New South Wales, a significant service gap was identified in the availability of culturally appropriate colposcopy. In order to access colposcopy, women were required to travel to Sydney as public colposcopy services were not available or available inconsistently. A consistent service had not been available in the area for over 12 months. In essence, we were asking women to travel greater than 250 kilometres from Orange to Sydney to access public colposcopy. Our aim was to plan a service where there were no out-of-pocket expenses for our patients in order to ensure the service was accessible as possible. A partnership was formed between Western New South Wales Local Health District, Orange Aboriginal Medical Service, the Rural Doctors Network, and Dr Michael Campion, the Director of the Pre-Invasive Unit at the Royal Hospital for Women, with support from Professor Neville Hacker, who's a really well-known specialist in this space, with the aim to provide a public nurse-led colposcopy service for the rural and remote areas of Western New South Wales. The meeting agenda saw resolution on a number of matters, including clinical operation from bookings to follow-up, Medicare billings, purchase of equipment, my education, training and mentorship, and talking about telehealth to support the nurse colposcopists and gynaecologists into the future. So my training consisted of a combination of procedural training and didactic education, focusing on cervical pattern recognition. Dr Campion has proven to be an excellent teacher and mentor. He's had experience in the United States working alongside nurse colposcopists for a number of years, and so it was great to get him on board. In August 2013, I completed a study tour of nurse-led colposcopy to New Zealand, the United States and Canada, where I met and established professional relationships with some of the foundation members of this specialty in nursing. Exceeding expectation, this study tour has served to increase my confidence, highlighted the need for nurse-led colposcopy and other services in rural New South Wales, and it's reinforced the quality of my training and education in colposcopy. Separately funded was my attendance at the American Society for Colposcopy and Cervical Pathology comprehensive colposcopy course in San Francisco, which is a pretty intense 4-day program, and on my arrival back into Australia, I completed a 2-day Australian Society for Colposcopy and Cervical Pathology colposcopy update in Brisbane. I've completed my credentialing through CQIP, which is a colposcopy quality improvement program, which involves keeping a logbook of cases, supervision, mentorship, mentor sign-off, attendance at courses and 2 exams. This accreditation is updated 3 yearly and is the same for GPs and gynaecologists. So here we can see on your left the first nurse colposcopist in the United States. Her name's Mary Rubin. She's still practicing and teaching over in the States today, and she started colposcopy for nurses about 30 years ago. Nurse-led colposcopy is a well-known service in the UK as well, and has been running for approximately the same time. So the lady in the yellow, you can see her name is Candy Tedeschi, and she has long been well recognised in the area of colposcopy for nurses in the United States. Picture of me there on the right is when I was invited to speak at the World Congress in Orlando in 2017. So there was 3 nurse colposcopists from around the world speaking on the subject of nurse-led colposcopy. One of them was me, and that was an extremely rewarding time for me. My talk was well received, and there was special interest, especially from South America and India, who have the same issues around lack of service and distance and lower socio-economic groups as well. Okay, so our first clinic was held on the 5th of July 2012. We had 3 people attend. Since then, we have had a monthly clinic growing to 2 days a month. We could do more, but we are really constricted by time and availability. We now see 15 or more women each clinic. Our referrals are made by local GPs from OHMS itself and other GPs from around Orange, Parkes, Forbes, Condobolin. We see people from Lithgow, Dubbo, Mudgee, all being referred into our clinic, which is great. There are no out-of-pocket costs for our patients except for travel, and we'll do anything to get our patients there. We'll organise and support them to get there the best way we can. So a key feature of our program is the compassion and consideration given to the needs of Aboriginal women in rural Western New South Wales. The importance of building rapport, taking time to explain and showing respect all address issues in closing the gap in health and life expectancy for our Aboriginal women. This model of care demonstrates an investment in prevention and early detection and shifts low complexity demand to a low cost setting. The early intervention and access to treatment is closer to family and country is extremely important to these women and allows for improved compliance with treatment regimes. Culturally appropriate care has seen this service establish a very positive reputation within a sensitive field. So where are we up to today? We've been operational for 6 years. We haven't missed a clinic. We work January through to December every year. We work in really close partnership with the nursing administration staff at Orange Aboriginal Medical Service, and I provide regular education for the staff on a range of topics. So that could be women's health, it could be whatever they need at the time. I make myself available on a monthly basis for them as well. So the 2 nurses on the left are our current nurses in the clinic, and the nurses and Aboriginal health workers on the right are a couple of current and past members of our team. And we just couldn't do it without the amazing support of those health professionals. So it's staying true to our goals. A while ago we did a snapshot client satisfaction survey where 100% satisfaction rate was noted. We collected quotes and information from participants who had attended the colposcopy clinic. All responses said that they were happy to attend in the future, and all felt that they had been treated with dignity and respect. Our data shows that the presentations from July 2012 to December last year, there's actually been greater than 30 women identified as being at high risk of developing cervical cancer, bona fide precancerous changes. All 30 women have been successfully treated and are under surveillance to make sure that that doesn't recur. The data provides evidence that women that present for colposcopy at OMS are actively followed up so as to maintain appropriate surveillance and to provide intervention if and when it's required. And our staff at OMS are really great at helping with that, and we maintain close relationships so that we can make sure that that surveillance is maintained. Since commencement of the service, there has been a consistent trend in reducing the number of non-attendance figures to the clinic, because initially that was quite high. Increasing numbers of patients directly accessing the service, and that's continuing to grow. Increasing the numbers of referrals from local healthcare providers, and we are getting a great number of referrals. Actually, we've just received our 1,000th referral for the last for the overall time that we've been there, which is a bit of a milestone, which is good. So we haven't quite seen that number. As you can imagine, there's been a number of fail to attends, but it's good. It's a great number to recognise the service. The nurse practitioner-led service has reduced the preventable and avoidable admissions to hospital for invasive and costly treatments for women with advanced gynecological disease. Just a few stats for you, and you can see here that the blue numbers there are from 2012, and then we did these in 2015 and 16. You can see that everything's improved across the line. We not only see patients for colposcopy, we also see women referred into the service for other gynecological issues, and so that's evident there under other. So we're growing there as well. Our Aboriginal attendance is now greater than 50%, which is excellent, and that's improving every month. Our project's been the recipient of a number of awards, including the Western New South Wales Local Health District ACI Innovation Award in 2014. We were the winners for that. And also that year we won the New South Wales Secretary of Health Award for Aboriginal Health, which is great, and you could probably recognise a few people in that picture. So what's happening in the future for us? We're planning to broaden the scope and access to the service, and this has been ongoing in partnership with Orange Aboriginal Medical Service and a Rural Doctors Network. Our plan is to make this service available for more remote communities through outreach and telehealth technologies, and we're looking to grow more nurse colposcopists in the future, although again, time, money are all barriers to these. There's a growing interest and demand for nurse-led colposcopy across Australia, and more evidence suggesting nurse-led colposcopy is safe and an economical alternative to address a community need in this ever-changing environment. There is hope that our success will encourage other services to consider and recognise the potential for expanding the scope of practice of nurse practitioners in order to address identified gaps in service. as this is a critical advantage of the nurse practitioner role in providing flexible and innovative models of care. Just before I finish, I just wanted to let you know what else is happening in our region. So New Zealand is a tad in front of us. They've been doing nurse-led colposcopy for the last, for 10 years before we started, so almost 20 years now. They initially had 3 nurse colposcopists trained. At the moment there's only 2 working. One resigned to open a brewery, which sometimes I wouldn't mind actually following in that pathway, but anyway. So we've got there's nurse colposcopists now training and providing treatment, so that's the large loop excision of the transformation zone. They're doing that quite safely and happily in New Zealand. Hopefully that'll happen here soon, one day maybe. There's a huge list for colposcopy in the North Island, and so they're trying to address waiting lists with nurse colposcopists, and their education, their standards are very similar to ours, and I have a colleague over there who's very supportive and an excellent resource for my work. Okay, thank you. I think that's it.